Welcome to Mount Sinai Future You, a show highlighting innovations and research at Mount Sinai that are changing patients' lives. As we celebrate Valentine's Day this month, cardiologists and their patients are celebrating life, as February is, well, fittingly, Heart Month. In this special episode, we bring you stories from Mount Sinai Heart, including the story of a young girl from Colorado. While playing in her backyard, Lila experienced terrible pain in her chest. Doctors diagnosed her with not one, but 2 heart conditions. She was referred to Dr. Barry Love, whose name reflects how his patients feel about him. Lila says she loves Dr. Love and is grateful for all that he's done.
It was Thanksgiving about 2 years ago, and Lila and I were doing gymnastics on the monkey bars in the backyard. Lila got off of the monkey bars and she grabbed her chest.
I felt really nervous and like, what was wrong with me? It just felt like my heart was like kind of jumping out of my chest. You know how a hummingbird like wings go really fast? It was like that's how I felt with my heart pain.
Within 24 hours, we were at the cardiologist and we were hit by a Mack truck. We're told that Lila needed 2 heart surgeries.
Lila had 2 problems that she came to us with. So she had a problem of something called supraventricular tachycardia, which is a fast rhythm from the upper chamber of the heart. And they also found that she had a large hole between the upper chambers of the heart.
Within days of getting this news, Dr. Love and us, we were on the phone so fast. And within a week, Dr. Love had made time to do her first surgery.
We needed to tackle both problems, and so what we did is we brought her for one procedure, and that procedure was to put little electrical wires in from the veins at the top of the leg. We put them in various places in the heart. We were able to stimulate the heart, figure out what this fast rhythm was. It turns out it was a short circuit within the normal conduction system, and what we were able to do is apply some radio frequency energy to the tails of the normal conduction system so that that short circuit could not happen anymore in the upper chamber, and her rhythm problem was cured. We did the first procedure. We then brought her back and were able to close that hole in the catheterization lab. She did very well, went home the next day.
When I had the heart surgery, I felt way more energetic.
I'm like, maybe we want to get something, get a little tune up, give me a little bit of extra something here so we can try and keep up with her. I think we're definitely most thankful that Lila's here and she's fixed. And you know, we're all able to be together and chase our hopes and dreams and live the life that we always dreamed about.
Lila loves books and says she wants to be a writer one day. The Familia Project teaches children healthy habits to reduce the risk of heart disease down the road. Based in Harlem, this program focuses on healthy eating, physical activity, and making the right choices. More now on the Familia Project.
The Familia Project is based on a concept. When we teach children between age 3 to 6 years of age anything, including health aspects, like health is a priority, this comes back when they reach adulthood. So it's the ideal age to do something of this kind. We decided to get into a minority community in Harlem and begin to work in 600 families.
We have problems in our family. One of the main problems we have in our family is diabetes. We are Hispanic, so in the Hispanic community we tend to eat more. They say the more the better. We actually made changes in the portion size meals, and we actually incorporated more exercise.
We teach them how the body works, the issues related to nutrition and diet, the physical activity aspect, and finally how to control your emotions, we tell children. And basically we teach them to learn to say no when in the future they are confronted with alcohol, tobacco. We are really dealing with what I think is the window of opportunity to have impact on people when they reach adulthood.
We used to fry things a lot. We actually started baking more things on the oven. We do go shopping for food, and I think that's the opportunity where we can buy vegetables and fruits.
You put peppers in them?
Yeah, and this is good, right?
What?
We see young people having diabetes, so we definitely have to modify how we eat. We want to live longer for our children, so we definitely want to make those changes.
What we find is significant benefits in all respects. Their knowledge, their attitude, their habits are quite different, and this is very, very exciting.
1 in 3 women is affected by heart disease. In our next segment, we learn more about a new initiative that's raising awareness and educating women about heart health.
Go Red is an American Heart Association initiative that's been around for over 10 years, and it's a campaign to really increase awareness about women's risk for heart disease. Women still think that breast cancer and other types of cancer are the #1 cause of death, but really, heart disease is an equal opportunity disease that really affects both men and women. 1 in 3 women are affected by heart disease, and every minute, according to the American Heart Association, women die from heart disease. We started this over 10 years ago, and it's just continued to grow over the years to increase awareness and help women understand their cholesterol levels, understand stress of smoking, high blood pressure.
I'm going to give you a couple of tips on how to prevent heart disease in women. Number 1 is know your family history. So you need to know whether there's anyone in your family who had a heart attack or stroke. 2 is if you've been pregnant and you had diabetes during pregnancy or high blood pressure during pregnancy, you have to tell your doctor because those are risks for heart disease later on. Number 3, you have to work on stress reduction. Stress increases blood pressure and heart rate and increases events. So you need to think of things like meditation, yoga, and exercise. So talking about exercise, at least 30 minutes a day. And then when we talk about healthy eating, it's really, we want a diet that's high in fruits and vegetables, especially the dark berries, blueberries, strawberries, have good antioxidants. And finally, sleep. You really need 6 to 7 hours of sleep. Untreated sleep apnea increases the risk of heart attack and stroke in women and in men.
So as you can see, this is done by all nurses. All nurses within Mount Sinai Heart come out once a year. It wouldn't be as successful as it is today if it wasn't for them. They've all come out, they're all in their red scrubs, it's just wonderful.
A young couple was ecstatic when they found out they were having their first child. But that excitement was replaced with concern when they learned their baby had congenital heart disease. We now introduce you to this special family.
Happy birthday to you. Devin is an ordinary 2-year-old. He is energetic, independent, rambunctious.
He runs, he climbs.
He is our little tornado. It took us 4 years to get pregnant. We finally got pregnant. We're like, oh my gosh, thank God. We went in for the 17-week early anatomy scan, and we were sure that everything was going to be okay. And at the end of the appointment, they said, well, we've noticed that the baby's heart is slightly shifted in his chest. Your son has a congenital heart condition called tetralogy of Fallot. He will need open heart surgery. However, he is in tachycardia, and his heart rate is twice what his heart rate should be, and we need to get medication to him, we need to hospitalize you, and he is at risk of fetal demise. It's a time when you're pregnant and you're like supposed to be a peaceful, happy, beautiful, wonderful, exciting time. And I just felt unbelievably stressed. There were so many unknowns. We didn't know if he was going to make it.
At that early an age, at 17 weeks, to have a fetus in tachycardia is very, very rare. Normally we make this diagnosis much later.
Dr. Srivastava laid out basically the entire plan for us. We had a high-risk doctor, and our doctor was going to be there, and there was going to be a team of doctors and nurses from the intensive care unit that was going to take the baby away immediately to do all these tests. And then after he was born, we were told he wasn't allowed to cry, and we had to constantly be monitoring his oxygen levels, which, of an infant is not that easy.
I spoke to my surgeon and I said, really, I think we should just do the surgery. We shouldn't wait. I'm really happy I made that decision that day. And he recovered very well from the surgery.
He is a kid who he falls down and he gets right back up and keeps going. Because what he went through, it's almost like he has like a real appreciation for life.
Every year, Mount Sinai has a reunion that brings together children who have had heart transplants with their nurses and doctors. The gathering is an opportunity to give thanks to life and the journey ahead.
I first met Fetty when she was admitted here at Mount Sinai when she was very sick. She was in severe heart failure and she needed to be listed for a heart transplant.
Last year, I thought I was the loser, and this year I could hug her again.
It's very fulfilling for me to be here to watch someone go from very sick, not knowing, what the next day was going to hold, waiting and hoping for a heart, to then being here after having a heart transplant, being a healthy, normal kid.
We have an annual reunion to bring the patients that have been operated on here or have undergone other procedures for their congenital heart defects. This affords the families the opportunity to come back with their children, not as patients, but as kids enjoying a party. And it allows the staff, there's a large multidisciplinary team who get to come to the party as well and see those kids having a great time.
I'm really glad to be here with my new heart and alive, basically.
89-year-old Milton Bagley needed heart surgery, but open heart surgery was a risky choice given his age. So surgeons at Mount Sinai opted for a less invasive procedure. Milton Bagley says he's healthier than ever and shares his story in our next piece.
I was short of breath. I was, you can sense what your body is telling you. I couldn't get from the parking lot to the front door. Bit of chest pain, and so I came to see Dr. Fuster. And as I mentioned to you, I came up on a Monday with a ticket to go back on Tuesday. I figured he's going to say, see me in 3 months. But he says, you're not going anywhere.
He began to have shortness of breath, and at that time I reached the conclusion that he actually had a problem with the valve of the heart. Dr. Sharma got involved.
We had to do something about it because studies have shown that if your aortic valve is narrow, if you don't fix it, almost 8 to 10% people can have heart attack, death or stroke almost every month. He was not a typical candidate for open heart surgery.
I was told a year ago, 2 years ago, if you need a valve, they're not going to go through the chest, you're too old.
The open heart surgery really takes the toll on the patients, even if it does not cause the mortality, it causes morbidity, basically because of the recovery of the incision, sometimes the difficulty in breathing, sometimes swelling in the legs and so.
The decision to undergo the aortic valve replacement is a decision done here by the heart team. Involves many of us, including the surgeons. A group of heart specialists that get together and they say, what, how old is he? Age 89, and so what? Maybe he has 10 more years, or even more. Why not?
We are offering this percutaneous transcatheter valve treatment called TAVR. So we do a small cut. We call in just under the collarbone, the artery below the collarbone, we expose. Usually surgeons do, our cardiac surgeons, and then they put a small tube through which the valve goes in, and once the valve is deployed, then the cut is closed by the or repaired by the surgeons. So this is cardiac surgeons does, but advantage is no opening of the chest, no breaking the bones. The transcatheter valve replacement procedure has come up in last 7-8 years as a very good tool in patients, particularly those who are high risk for or intermediate risk for heart surgery.
Since that time when that happened, how do you feel?
It was a miracle. A miracle. Gradually, I came back to where I was and much better. It's a miracle operation.
He was able to breathe better, walk better, and he felt 100%.
I just walked 8 blocks for a sandwich. The first 4 being uphill on Madison Avenue. I had no trouble.
Oh, he looks wonderful. He looks young, in his 70s. I mean, he wants to do things, he has good ideas, and he was excited, he was thankful.
I expect that within 2 years, even in the younger patients and lower risk, this transcatheter procedure, TAVR, will be done because it has all the plus. Means in major endpoints, it's as good as surgery, and many points, it is much better than surgery.
Patients come to Mount Sinai Heart for top-notch care from world-renowned experts. We end our episode with a vignette of stories. In their own words, these grateful patients share how their treatment saved their lives.
If I had what they originally thought, which would have been, in quotes, not a big heart problem, I would have been fine. But I didn't have just that, and I didn't have symptoms, so I could have just dropped dead at any time. My doctor said go to a cardiologist. I called 2 on Long Island. They couldn't see me for quite a while. And I said, I just want to get this off. There was no urgency for this. I said to my husband, I'm going to call Dr. Fuster's office. And what a difference.
Very subtle kind of history, which didn't say, oh, I've got a problem with my aorta. But once he got the echo, there it was, that the aortic valve was a problem. Looked like it was as big as 7 centimeters, which is way more than twice normal size.
I was not scared for a minute, and I knew it was serious. Every single person that was talking to me was so competent that I knew I was in the very best hands.
Quick response, and most importantly, the integration of all of us, and this is what Mount Sinai Heart is all about. This was the first institute in the country in which we pulled together all the cardiovascular specialists. Every day we are all working together.
It was definitely Mount Sinai knowing how to care for a patient, how to get the patient in timely, and being so efficient and competent that they caught this right away. I've been with a lot of doctors, and this was far superior.
It was a lot to take in. I really shouldn't be going through what I just went through, but I did. I'm Dominique Hines, and I had open heart surgery at 14.
I took her 3 times to her personal doctors, and they all said she had a virus. So Monday when I got home from work, I was going to take her to the lab, but when I got home, Dominique couldn't get up out of bed.
Dominique was sick for almost 3 weeks prior to the diagnosis. When she was admitted to a local hospital in New Jersey, when they did the blood culture and they found that she actually has an infection. Endocarditis, which is a diagnosis she had, means an infection on one of the heart valves, as the mitral valve. She was transferred to us in an attempt to save her mitral valve. And most of the time, it's difficult for you to save the mitral valve. So usually you have to do a valve replacement for these cases. And valve replacement in a child who's 14 years old is basically giving her just another disease to live with for the rest of her life.
When I asked him what's the prognosis, he said, no, I think she has to go for surgery now.
The team was 3 surgeons, Dr. Adams, me, and Dr. Khan Wing, due to his expertise in pediatric cardiac surgery. During the surgery, we found that definitely her mitral valve was almost destroyed. Due to Dr. Adams' expertise in mitral valve repair, he was actually able to repair her mitral valve. Surgery for that kind of pathology is almost a valve replacement if that surgery was done elsewhere.
After the surgery, I had my birthday. Everybody came.
When we saw her again in the clinic, I wouldn't imagine that this was the same person. We saw her almost dying at the bedside that night.
She's a strong little girl.
I would love to see Dr. Adams and give him a big hug, just to praise him and just to thank him for saving my granddaughter's life.
I walked into his office and, with no warning, had a sudden cardiac arrest. The team immediately flew into action and I was resuscitated there on the spot. Dr. Finkelstein, who actually saved my life there in his office. And when I found out afterwards, of course, it was a very emotional, it still is, an emotional moment. The staff was really amazing. Without nurses, I'm not sure how these modern medical centers could work because they really are the connective tissue between the specialists, your doctor, the staff that's working around you. They really pay attention to everything that's going on. Every day I wake up, I say, thank goodness, I may not have been here.
I had a relatively easy pregnancy, no complications, no symptoms of anything going wrong. I actually loved to be pregnant. I gave birth to my son, everybody was ecstatic and happy, and then that night I didn't feel that well. When I came into the emergency room, they told me that my heart was only functioning at 14%. They didn't know how I was still walking and talking. I was scared, definitely. I was confused and just very unsure of what this meant for the future.
I'm very glad that Melinda came here to Mount Sinai because we are experts in the field of advanced heart failure. We knew that in order to maintain her survival, we were going to need to put in a ventricular assist device.
I remembered crying going into the operating room, and they prepared everybody that I might not wake up for 2 or 3 days, and I woke up that night. Begging to be taken off the ventilator. I was sore, but I wasn't coughing. I wasn't getting short of breath. I actually felt like how I should have felt right after giving birth.
You know what impresses me about Melinda is her spirit. She is definitely a fighter. She's someone who pushes on.
I love the team that I have here. Mount Sinai, and especially Dr. Pinney and my surgeon, Dr. Ani, have been phenomenal. I think having that personal relationship with me put me so much more at ease during my recovery process. I owe my entire life to them. When I went into the hospital and he was still that tiny little infant, now he was, you know, sitting himself up and starting to roll around. It was so nice to be able to see that, especially not knowing that I would ever be able to do that.
We're very much looking forward to carrying Melinda through the next phase of her treatment, which is her heart transplant. I have no doubt that she's going to do great.
So my hopes for the future, obviously to live a very long life, experience watching my son grow up, watch him get married, but being able to enjoy my life.
My father died at age 52 of a heart attack. My mother died at 70 of a heart attack. And my older brother died at 81 of a heart attack. I've had 3 heart attacks. I've had this congestive heart failure for many years. He would prefer that I just go home and go about my life. He didn't think anybody in New York would even attempt to do it. When I mentioned Dr. Sharma's name to my cardiologist, he said, is that Is Salman Sharma from Mount Sinai? I said, yes. He says, by all means. He says, he's world famous. I would be very happy to send him all your records.
Stanley's blockages were very complicated because very hard and calcific, and because of his age, many hospitals will not treat. Looking at the angiogram, I saw that he has very extensive blockage and he was at risk of having a heart attack any day. So I immediately, when I spoke to him, I said, come right away, even today.
That afternoon, he opened up 5 arteries with stents.
Expertise where you can take care of the very complex blockage, completely blocked arteries, or calcific, that means there's a lot of calcium deposit in the arteries, are done at few centers. And Mount Sinai is well known for it.
I have no doubt that if it wasn't for him, I would be dead at this point in my life. Dr. Sharma, I hope you continue to practice medicine at least till 100 years old, because you will have saved any number of lives in the intervening time. And I couldn't wish you anything better than that.
Thank you for watching Mount Sinai Future You. Be sure to follow us on Facebook and Twitter for updates on our next episode.